The other thing you may have noticed on our webpage is we are putting out a map that shows the location of the confirmed cases. It also shows the location of suspect cases. Those are cases that have been coming into the system either through one of the healthcare facilities or clinics or directly to the Department of Health. And based on their symptoms, based on their history, based on information they provided, there is a possibility that they might have contracted dengue. And with that, their blood sample is drawn, it's analyzed at the lab on Oahu, and the results come back really quick. And you may see some of those suspect cases on the map change from a yellow dot to a blue dot, which means they were ruled out or they don't have dengue. In other situations, they may turn to a red dot, which is confirmed they did have dengue.
We have a map there as well. It's pretty kind of similar to CD's map. CD gives you a little bit more resolution on exactly where those cases are with the pins. The Department of Health map, I think both maps are great. If you love data, if you like this kind of stuff, you're going to want more. So both of them are, I think, equally well in what they're trying to say. So the Department of Health one kind of gives you an idea, these ovals of risk, and that's based on mosquito activity, number of active cases, and whatnot. More importantly, I want people to also go to the Department of Health map and look on the left side. That's what's called an epi curve. So on the x-axis, you have the onset of illness. Your y-axis, right, tells you how many cases. So we can actually see, you can't see this on the map that time. That's what kind of Chief Oliver was talking about. So yeah, we're at 130 cases. But those that were sick in October, as I mentioned, your symptoms only last 1 to 2 weeks. Everybody in those first waves has recovered and is totally fine. So when you look at that epi curve, actually what you're looking at is the progression of this particular outbreak. And so far, we've had a little dips, and that's expected because as we do these community meetings, as we get more press about this, more people are going to come forward. So we expect that case count to rise, right? What's really important is not so much that it's rising. What's important is if that number starts to exponentially climb, that means this outbreak is moving beyond to more larger populations and being more effective. So if that number maintains a steady course, we're doing our job of informing people, stopping the transmission where we can, and hopefully we can nip this in the okole.
The county is producing the maps of the cases. The maps are really inaccurate. It just shows Pahoa 20 miles or something. I just looked at the Singapore Department of Health, where they have endemic dengue there, and they regularly, every week, inform people where were the cases this week, on which street. What's stopping you from doing this? I like to know if on my street there was a case, then I will be more prepared, and that, you will eradicate this much faster. What's the problem with that?
Sure, we appreciate the desire and interest with getting right down to the individual address. However, in the United States, there is a federal law that prohibits us releasing patient identification information because each one of these cases is technically a medical patient under the care of someone, as well as their records are protected. So the map we're providing, although it doesn't allow you to get right down to that address, it gives you an idea that within subdivisions there are cases. And I think the point we're trying to make with our map is let you know that this is an island-wide issue. It's not limited to just the Kona area as maybe initially was thought. And we should basically all be doing every day good practices to minimize our exposure, because even if we show you areas today that have no cases.
I don't think you are correct on this, because I'm not asking where the patient is. I am asking the street, that particular street or the neighborhood, that there was infection and the infection was this week or 3 days ago or wherever, and that you're not going to be violating the privacy issues then, because I don't want to know the address, I don't want to know the guy and obviously shake hands with him or whatever, meet his mosquitoes. I like to know that if I was planning my trip, say to Pahoa or to Hilo, that particular place, store or whatever, and I've seen there was a case, I maybe restrain this for a week or two, and that will help everybody to get away from the cycle. The mosquito lives only for 3 weeks or so, and if we all get on it more, what you can do more, provide the information about the streets or the neighborhoods, I think that might help. wouldn't violate nobody's privacy record.
And we actually have the information we're putting out being reviewed by the Attorney General and the legal people to give us some guidance, because we do appreciate the community wanting to know more. Because as you said, people want to have the opportunity to make a choice of whether or not you're entering an area of maybe higher risk. We're treating it as everywhere is an area of risk and what we can do to protect ourselves. But again, we're trying to make sure, one, we don't violate the rights, and we'll continue to ask the legal officials how much information we can make available at the request of the public for more detail.
I have another question, because
So to tell you where the guy is absolutely a waste of time. The guy could have been anywhere. He could have been in your backyard. Now he's living in Kona. There's really no good reason.
this particular person sits at home, locked in the home, yes, it will be the case where he is outside and bitten by mosquitoes. So, the public should be aware of there was a case on this neighborhood or this street, and restrain yourself from travel to that place. That's just for everybody's help. I mean,
I think it could help to have that map kind of dismiss some of those red cases, people who are no longer affected, so that we can actually see what's hot in neighborhoods, instead of just looking at this because we're going back to this big number of 130, and it's scary, right?
Right. I think that's what's brought up earlier in the meeting, was that our map is showing you the total to date and total confirmed to date, but it doesn't tell you how many of those cases are currently infectious, how many of them are old cases. So that's where, again, good feedback from you folks on how our map information can maybe be better, to give you a better idea of how many of these cases are actually old cases and these people are no longer infectious, but the number is at 130 confirmed cases. So we'll look at ways to refine the map, and part of it too is making sure the map is understandable, because we don't want to have information that can be confusing and create more fear and panic. But definitely we want to make sure we're transparent, that you know exactly what we're doing, what's going on, there's nothing being withheld or information kept back from you. So it's balancing privacy. Information that may not change what we need to do, because it doesn't matter where the resident person lives. We don't know where they traveled per se. We don't know where they picked it up. We should be looking at everywhere as being a potential source for exposure, infection, and then giving you data that gives you a true picture of how many cases are active versus our old cases.